Hey guys, I'm Dr. Mnemonic, and welcome to the hospital. The purpose of this channel is to help you ace your USMLEs by being the go-to source for high-yield clinical facts presented in a fun and memorable way. Mnemonics were instrumental to me excelling in medical school and on my board exams, and I want to share my fund of knowledge with you. So please, join me in the classroom to learn more. Welcome to the classroom, future doctors. Here's where we'll go through the most high-yield facts that you will have to know to do well on your upcoming exams. For each high-yield clinical condition that we will explore, we will learn about the presentation of the patient, including pertinent signs and symptoms, diagnostics. Beginning with the physical exam findings, we will move on to the relevant investigations, including lab results and imaging, and finally, treatment. Lastly, we'll talk about the recommended medical or surgical modalities. Our lessons will also be littered with various mnemonic devices to reinforce your learning and really make the important stuff stick. These nifty little memory hacks will include acronyms and acrostics, rhymes, chunking, clustering, and of course, imagery. Ultimately, you'll be able to recall the most important details of every clinical condition across all of the organ systems. Let's move on to our first lesson so you have an idea of what Dr. Mnemonic is all about. Today's lesson will be on pericarditis. When you think about pericarditis, it's helpful to remember the 3 P's. Patients will present with sudden onset retrosternal chest pain that is pleuritic, positional, meaning that pain is relieved by sitting up or leaning forward, and there is a prodrome that resembles a typical upper respiratory tract infection with dyspnea, cough, and fever. The vast amount of cases are viral and caused by the Coxsackie virus, but there are other etiological factors at play. The acrostic cardiac rhyme is a great way to hammer into your head the various other causes of pericarditis. These include collagen vascular disease, aortic dissection, radiation, drugs, infections, acute renal failure, cardiac, which symbolizes myocardial infarction, rheumatic fever, injury, neoplasms, and Dressler syndrome. Let's move on to diagnostics. On physical exam, the only pertinent positive finding is a friction rub, only in 30% of patients. That's why you see someone being massaged, to help you remember the rub. There will be no pulsus paradoxus, tenderness or edema, Kussmaul's sign, or jugular venous distension, which is more indicative of cardiac tamponade. The best initial test is the EKG, where you will find universal ST segment elevation, hence the picture of the elevator, and PR depression, hence the picture of the sad boy. For CBC findings, try to remember the following rhyme: CBC may show 3, WBC, ESR, or CRP. This is because all 3 may be elevated. Chest X-ray may show pericardial effusion with water bottle appearance of the heart. Chest CT may show constricted, thickened pericardial sac, but this is rarely indicated in acute pericarditis. On echocardiography, there may be effusion or constriction, and the effusion may be new or worsening. Now let's move on to the best treatment of pericarditis. The best initial medical treatment are NSAIDs, including indomethacin, naproxen, aspirin, or ibuprofen. If the patient has persistent pain, you could add a corticosteroid like prednisone orally. If the patient is undergoing hemodynamic compromise, consider surgical treatment with pericardiectomy or pericardiotomy. Pericardiocentesis with needle aspiration may also be considered. We're done for today, guys, but I had a really good time learning with you. I hope you did too. Join me for future lessons, and together we can destroy your board exams.